So the first thing you do is you're gonna lie down your back and you have your right leg externally rotated. Okay, and your fingertips are on your hip bones so they stay stable. And you're gonna open this leg out to the side, okay, and you're gonna lift the leg up. And notice how the pelvis shifted. Don't let that happen, that's better. Now you have to find a prop that holds this bone. Okay, so like just put something underneath your leg that keeps it completely still. Okay, so like a piece of furniture. Because it's 30 degrees abduction, 30 degrees of flexion. You let the muscle or you let the leg stay rested, and then you take your hand here, so you put your hand right there, and you're gonna push up with 10% of your maximum intensity, which means that you wanna think of lifting like 20% of the weight of your leg, okay? This is isometric that you're gonna do to keep your psoas strong. Okay, so like the way they teach it is if you could lift and press with all of your strength first, go ahead and try that. Push up really hard, rest, now do half of that. Rest, now do half of that. Good, rest, now barely lift your leg off my hand, right there, like even less. That's the amount that you press for 6 seconds. And you rest, and you do that 6 times, okay? Now, what you can do to make that stronger is you do the palpations. There's a femoral gap, so you have this knee bent, you have this leg turned out, and you feel where the adductor longus tissue is, so you push in, and you can feel that fiber. And then right at the top of the femur, right here, there's a little gap between where your quadriceps are and where the inner thighs are, and you press into the bone at the top right here. And it's not long. You just push in, go forward and back 1 millimeter, and side to side, up and down 1 millimeter, and side to side. That's it. And just the surface area is like 2 inches. Okay. And then you go to the navel. You go out 1 inch, up 1 inch, and you go in on a 45-degree angle, and you press into the vertebral bodies. And you can know that you're there by picking the leg up. So you press in, up and down, side to side, up and down, side to side, up and down, side to side. The navel is where L3 is. You need to go to L2. So it's side, up 1 inch, boom, like this. The length that you're gonna go is gonna be about 4 to 5 inches. Then you have this leg out straight. I'm just gonna teach you the isometric for this one. So the isometric for this one is you go out 20 degrees and you turn the leg in, okay? And after you turn the leg in, you're gonna lift the leg up 30 degrees and you place it down on a table. You take your hand onto the top of the thigh and you press up with 10% of your maximum intensity, super light. So push up lightly, that's it, that's enough pressure. And then you rest it, so it's 6 seconds, 6 repetitions, 10% intensity. Okay. Now, the palpation for this one, lie down on your on your left side and take your hand, so it's knees bent, and you have the anterior third of your pelvis. So you go in and you just outline the top of the pelvis like this, curling your fingers at the ridge and pulling up, curling in, pull up, curling in, pull up, just like that. And then I would go down it too. Then you find the greater trochanter, the top of your femur, and the IT band, and you cut the IT band into visual thirds. You go to the top third and you press in like this, okay? And this is stimulating the muscle that did not work. When I asked you to lift your leg up with internal rotation, you could not. So this is really important to keep. And if it's inflamed, that's normal, because when the muscle tissue turns off, you have more nociceptors turn on, which are pain receptors in the body, and it's gonna hurt a little bit. So that's the top third, and I like to outline the whole IT band. Do not stretch the IT band on this side. Like a classic IT band stretch, that's not what this needs right now. Then you go to the lateral condyle of your femur. So here's the top of the femur, here's the bottom of the femur. That little bone right there. You press into that little bone. That's it. That's the only point you touch. And it's like a little knob, and you outline the knob. So it has to be a circle, not just one specific point. And then you lie down onto your back. Well, actually, I can use the camera for this. So here's the tibia. Okay? This is the tibial tuberosity. So right below the patella, the tibia bone, there's this knob. You touch in that knob. And then there's a flat space to the left of it, right here. This flat space. Fill in that whole flat space. And then lie down on your back. Okay, that's the first video.